Welcome to today's webinar on Education and Capacity Building in One Health, Lessons from the Field. This webinar is part of a series entitled Reconnecting for Our Future, hosted by the Lancet One Health Commission. I'm Renzo Ginto, Director of the Global Health Program of the St. Luke's Medical Center College of Medicine in the Philippines, and the Commission's Next Generation Advisor, and I will serve as today's moderator. This webinar series is organized by the Center for Global Health at the University of Oslo, together with the Kumasi Center for Collaborative Research in Tropical Medicine in Ghana, and the Center for Global Health at the Technical University of Munich. For this particular episode, we are also joined in by the following past co-presenters: the One Health for One Planet Education Initiative, or One Hope, Southeast Asian One Health University Network, or SIOHUN, the University of Global Health Equity based in Rwanda, the Ohio State University Global One Health Initiative, the St. Luke's Medical Center College of Medicine William H. Quasha Memorial in the Philippines, the International Student One Health Alliance, or ISOHA, the International Federation of Medical Students or Associations, or IFMSA, and the International Veterinary Students Association, or IVSA. To all the members of these amazing networks who are tuning in, welcome to you all. Before we start, I just want to make sure that you're aware of a couple of things. When you registered, you agreed to the session being recorded. The link will later be made available to those not being able to attend. All participants' microphones and videos will remain inactive throughout the session. And this 1-hour webinar will begin with an initial round of opening remarks from our panelists, to be followed by a Q&A session. So to our participants, you are invited to type in your questions, either with your name or anonymously using the Q&A button, and I will be reading them to our panelists later. Today, we have almost 300 participants from around the world registered. We are also joined in by several members of the Lancet One Health Commission. Welcome to you all. So COVID-19 has strengthened the case for producing a global cadre of One Health professionals. While the number of students interested in One Health continues to grow, opportunities for training and capacity building in One Health remain limited. In this webinar, panelists representing educational institutions and university networks will present their ongoing educational initiatives, examine challenges and opportunities in One Health capacity building, and propose solutions for the way forward. So now I'll be briefly introducing our panelists. I will not be reading their amazing bios, which are readily available to you in the webinar's webpage in the website of the University of Oslo. We will start with Dr. George Luedecke. He's the chair of the International One Health for One Planet Education Initiative, or One Hope, to be followed by Dr. Vipat Kuruchitham. He is executive director of the Southeast Asia One Health University Network, or SIOHUN. He will then be followed by Dr. Phaedra Henley, who is the director of the Center for One Health at the University of Global Health Equity, or UGHE, in Rwanda. And then we will end with a presentation from Dr. Wandwosen Gabrias. He is executive director of the Global One Health Initiative of the Ohio State University. So let's begin, and may I call on George to give his 5-minute opening remarks.
Thank you very much, Renzo, for the invitation to be a member of this panel. I'd like to thank your team as well, and discussing this very timely topic. So as you can see, hopefully, the name of my presentation is One Health Education Capacity Building in a COVID-19 World. Right, so I think to give a context for my few minutes here I thought it might be interesting to just look at where we are in terms of COVID-19 and its impact on the world, really. I think this image in front of you there really defines the years that we're currently experiencing. So when we look back to January 22nd, 2020, you can see the number of confirmed cases, and you can also see the confirmed number of deaths. When we go right back towards the end of September, you can see that deaths at that time were 33 million globally, I think it's about 35 million today. And if you look at the number of cases, they're over 1 million now. So the countries with the most COVID-19 cases that many of you will know are listed on the left there, from 7 million going up to 8 million quite quickly, right down to, well, over 1 million Russia. So the impact is global, the impact is quite fierce, and it's totally unprecedented. In terms of what it's doing to us, we have 7.8 billion people on the planet. It is amazing in the short period of time really that this is happening. But if you look at East Asia, the Pacific, there are 239 million, 0.8 million people who are being pushed into poverty, in South Asia as well. And then Latin America and the Caribbean, 54 million are predicted. I think these numbers are probably conservative, and they're probably more in the offing as we go through the next few months, especially when the flu season hits as well. The global response has been, in terms of many other risks or perils that we're facing, the Sustainable Development Goals, that many of you know a lot about already, but certainly they were agreed in 2015 by pretty well all nations of the world. It's about poverty and protecting the planet. The problem is, of course, is that the COVID-19 has become a reality, and we are now seeing across pretty well across all our goals and targets and indicators a huge epochal reversal of all the progress that has been made, which is really to the detriment of the globe, of all of us. And there is definitely now, I think many of us will agree with this, there has to be a renewed commitment to new global values, principles, and actions. One of the key recommendations is really to consider, before we get to the recommendation, consider what's really happening. Think of climate change, loss of diversity, COVID-19. What's really important is that we consider the root causes for all of these. Basically, they are first and foremost, they are really caused by human beings, us. And it's time to stop, think, and do. So the One Health concept, which I call a concept, others as well, it used to be more better known as a movement, an approach. I think it's gradually becoming a philosophy of doing things. So it basically has two main messages: the interconnections among humans, animals, plants in a shared environment. The interdependencies cannot be denied. And it also speaks to collaboration across sectors, I must say, collaboration across nations and regions, of course. And our main challenge is really one of sustainability. So the World Bank and many, many other organizations are behind One Health now, which is really important to hear and to know. And what is also equally important is the One Health and Wellbeing is now, we're coming to the conclusion, informing just about every aspect of human activity, not just medical science, veterinary medicine, and so on, but all human activity. These are fundamentally at risk, really, if we disrespect humans, animals, plants, and our environment. So global priorities were made clear recently by the Angel Gurria, who is the OECD Secretary General. And I thought his paper was, excellent, very short, but really crisp. He talks about a green and inclusive recovery that we all need to think about now, prioritizing, of course, incomes and jobs. The estimate right now is that there are going to be at least 200 million people who will become unemployed because of COVID-19. The focus has to be on those who are the most disadvantaged, the poorest, and has to focus on the well-being of all of us. But the people I just mentioned is certainly a high priority. It also has to focus on climate and biodiversity action and overall resilience. There's a fundamental societal reorientation that I feel from my research and so on that has to occur now, which we really didn't think was possible so quickly. But we are now reminded every day that what is really controlling human beings and all species is our biosphere, which impacts on our society, how we live, which impacts on the economy. Right now, to a large extent, I would argue we've got the chronology here in the wrong order. The SDGs are invaluable, I think, as well, because they support each of these components or each of these reorientations. What we're heading towards more and more is, of course, the need for a circular economy, doing away with waste and pollution and so on and so forth. And there's a very short video that I'm showing you there. Sir David Attenborough has just put one out on plastic and water, which really makes the case really much, much better than I do. The rationale for what I'm saying, basically, and one could go on and on, of course, I sort of try to cover in my current book, Survival, One Health, One Planet, One Future, in which there appear the 10 propositions for global sustainability. Number 7, I think, is vital. It's about using the unifying One Health and Wellbeing concept to underpin as a cornerstone for society and for education in particular. So in a new normal, what we need to think about more and more, I feel, is that it's a matter of not only workforce development, but societal development, which goes in tandem with workforce. We need new values, knowledge, and competencies, and our research and education should be informed by transdisciplinary orientations, and basically deal with the present and the future much more so than we have done in the past. It's about lifelong learning, and I think that our greatest challenge is really the following. It's making a paradigm shift, changing our worldview from human centrism, which is really what we've all been doing for the last millennia, human centrism, changing that to ecocentrism, which is basically making sure that humans or that we as humans are satisfying our needs, but we cannot ever forget the need to satisfy the needs of the ecosystem as well. I think to a large extent, the United Nations must take the lead here. I'm not too sure whether that's going to happen. So in terms of an education project that Renzo has alluded to, he was speaking about the International One Health for One Planet Education Initiative, short form One Hope, which is really informed by two things, really, the One Health concept, the well-being concept, and also by the SDGs, and in association with the One Health Commission and the One Health Initiative, and I must say, increasingly so, going back to SDG number 17, partnerships formation. We currently have over 34 organizations who are a part of the external advisor group that we're forming to help inform the One Hope initiative. In short, what it's about is really progressing One Health and Wellbeing and the SDGs across 6 global regions, and how we're forming working groups with facilitators and teams, working groups. You can see some of the titles for their groups, and we're hoping now this year and next year to develop pilot project proposals that fill some needs or gaps within the regions. Here's a list of my colleagues who are actively engaged in pursuing, in developing the One Hope concept. And if anyone has any questions and so on, please call on any of us, and we'll try to help as much as we can. Thank you very much.
Thank you very much, George. Thank you for that opener, a very broad vision for One Health. Thanks for situating it in the context of the Sustainable Development Goals, which you describe as experiencing an epochal reversal as a result of COVID-19. And maybe later during the Q&A, we would like to learn more about, how can One Health help in trying to address that, and also our participants might have some questions about One Hope, which you just introduced towards the end of your presentation. So thanks, George. Now let's have Vipat, who will be sharing about the Southeast Asian One Health University Network. Please take it away.
All right, thanks, Renzo. Thanks for the invitation, and a good day for everyone. So we did a short 5 minutes. I won't use any slide and just talk to you. So we'd like to begin just starting with sharing the highlights. So in 2018, the QS World University Ranking, which a lot of universities actually decide for to be among the top about the reporting on the global skill gap in the 21st century report. So this is what it said. So it is becoming more and more vital that university also prepare graduates for the world of work. This means that the development of soft skills like team playing and resilience often become as important as the technical skills and the knowledge acquired during a degree. So this is the principle that we try to transform and change the university to prepare the graduates actually ready for the real world work. So we totally believe in the workforce development that being fundamental for ensuring a sustainable and effective health security system. So therefore, we try to advocate for people to invest in human resources, because as one of the report saying that if you invest in strengthening both the human and animal health system, you're going to have a return on its investment of 10 to 1 or even higher. So it's really worthwhile. So our group established on the fundamental of try to develop One Health workforce for the future leaders. So we're being supported by the USAID. Our group established since late 2011. Right now under phase 3 with the name of the One Health Workforce Next Generation Project, being led by the Prime of the University of California at Davis with its consortium. So we have 2 regional networks. One network that I'm taking care of is CEO Hun, Southeast Asia One Health University Network. We also have our brother sister network called AfroHun, which is African One Health University Network, doing similar things. So let's bring down from the global level to the regional level of the Southeast Asia. So our mission for the Southeast Asia One Health University Network is to develop a resilient and competent One Health workforce by leveraging education, research, and training provided by university networks in Southeast Asia. So when we established, we starting only with the 4 countries and 10 universities in late 2011. But right now, at the 2020, we have grown to cover 8 Southeast Asia countries. And we have 84 universities working together to develop One Health professional. So with that, what university can do, this is what we try to advocate for in 3 aspects of what university should do. One, when the university actually train the people, they should not train only on the technical skills, as the QS will report saying. So don't focus solely on the technical skills when teaching and learning about One Health, but we should transform the graduates and the students become more the active learners by applying learner-centered activities and having multidisciplinary learning. Students can come into learning together for their journey to become One Health leaders. Because interaction among the students with the people with a different perspective from the animal health, human health side, environmental health, very pivotal in terms of working together to combat emerging health threats. For the second aspect, as we know, universities are very good at doing research, right? But the research should not be satisfied only by the researcher and academic promotion only. The research should matter to support the government in terms of their policy making process. So to supply the evidence-based information for the policymaker to address your national needs and the gaps that they want to address and make a decision upon, rather than just doing a research just for publications. So the third area that we try to advocate for, I think the university can play a big role in doing a public health search capacity. As we're dealing with the COVID-19 now and the health professional being overwhelmed with so many aspects. If we can engage the university, which some countries do, right, in terms of laboratory diagnostic that can increase capacity with the government, or deploying some of the students to be a helping arm to do the outbreak investigation, that will be very helpful. Our model with the African One Health University Network, they actually deploy their students to do an Ebola outbreak during the Ebola outbreak. So it's a win-win situation. The government has a helping hand of having more capacity. The student side, they also get to practice at the same time. So I'd like to end concluding my short 5 minutes here that we try to promote the collaboration among not only the university, but also ministries and the private sectors in developing One Health workforce. Try to generate evidence-based information for policymakers and try to maintain public health research capacity. I think that's the role of university, that's what we can do. So I end my talk here. I'm gonna drop my email through the chat box. So if anyone would like to get in touch with us. So thank you.
Thank you so much, Pat, for that those very powerful messages. And I would like to actually encourage our participants to visit the website of Seohun, which has lots of resources. I think you even have some of the materials that you actually use for your participants, your students, readily available to anyone who would like to bring those One Health knowledge materials and products to their own institutions. You already touched on the potential role or the actual role of One Health capacity building programs in pandemics such as what we're having now, COVID-19. Maybe later we can explore that even deeply. So from Asia, we'll jump to Africa. And we have Phaedra Henley here, who is heading the young but very vibrant Center for One Health at the University of Global Health Equity in Rwanda. So Phaedra, please, the microphone is yours. The imaginary microphone.
Hello. Thanks for the introduction, Renzo. I'm Phaedra Henley, the director of the Center for One Health at the University of Global Health Equity. So I wanted to start by talking a little bit about UGHE. It's a new university based in rural Rwanda that is building the next generation of professionals, doctors, nurses, researchers, into leaders and change makers who strive to deliver more equitable, quality health for all. Our unique focus on One Health and practical experiences outside the classroom ensures that students understand the complexity of ensuring health in all settings. While many international organizations have adopted One Health as an important approach, implementation has been limited. Some of the barriers have been in educating professionals. With the recognition that an interdisciplinary and multi-sectoral approach is integral to self-health challenges, UGHE from its onset prioritized a One Health approach into its design, programming, and research. The One Health approach takes disciplinary strengths and their best practices and compels them to work together. It challenges existing barriers and provides a platform to consider new, innovative, and forward-facing solutions. And that's why UGHE started the Center for One Health. Critical to this approach is to both integrate One Health concepts across all curricular programs, as well as to create One Health specific programs. The Center for One Health integrates One Health across programs, including currently in global health delivery and medicine, as well as in future programming in nursing, gender, pandemic preparedness and response, and research. The integrated curriculum includes the foundations of One Health, including what it is about and why it's important, special topics in One Health, as well as the application through site visits and a field school. For example, in the medical degree program, future doctors take an introduction to One Health module where they learn about One Health, why it's important. They learn about taking a One Health patient history, and they undergo case studies showcasing how our changing environment impacts health and a role a physician can take. One Health is also integrated into more clinical modules such as infectious diseases, as well as clinical pharmacology. For example, when students learn about the toxicology of heavy metals, they will also learn about how these contaminants move through the environment and through animals as routes of exposure. This year, with a demand for such programming, as well as in a world where this type of programming is critical for survival, UGHE has also started an option in One Health in its Master of Science in Global Health Delivery program, with One Health specific modules such as climate change and health, infectious disease management, and neglected tropical diseases. Here, students acquire discipline-specific competencies as they embark on their careers as One Health professionals. Critical to the training of a One Health professional is also the development of cross-cutting skills, such as management, leadership, cultural sensitivity, and policy and advocacy, among others. At the end of the program, students participate in a One Health practicum in order to apply the skills they have acquired to address a One Health problem within an organization or a research project. Part of the learning and application of One Health at UGHE is through field-based learning surrounding our campus in beautiful rural Rwanda. Site visits include a local pig farm, wetlands surrounding the campus, and homesteads in the community. Students learn from implementers, such as the pig farm's veterinarian, the district's environmental officer, and community members. This allows students to place themselves with their various professional, academic, and cultural backgrounds into day-to-day health delivery. For example, at the pig farm, students observe the direct interactions between the farmers, the pigs, and the environmental setting the farm is located in. At the end of the program, a medical doctor who participated in these site visits would ask patients more questions to determine their history, such as whether they interacted with animals. This more holistic approach to health may provide the clue to determine the cause of the patient's condition. In summary, global challenges that are found at the animal environment and human interface are ones where health professionals are undertrained. This widening responsibility for health across disciplines brings with it the recognition that an important transformation is required for the upcoming workforce. The Center for One Health at the University of Global Health Equity in Rwanda is filling this gap through practical One Health programs for all students, whether they are in medicine, nursing, or global health delivery. Thank you.
Thank you so much, Phaedra, for that very vivid presentation. Now we would like to go to Rwanda just by looking at those pictures. Hopefully after this pandemic, we can all convene there and have more face-to-face joint learning about One Health. And I'm seeing one comment from Rohini Rupnarine. She said, great to know that One Health is being applied or mainstreamed into the training of physicians. And perhaps later on, we can also have a discussion about how about for other health professionals and other professionals who are not necessarily considered as part of healthcare. So we will be having a discussion on that shortly. So now we've heard from Phaedra and the example of the University of Global Health Equity in Rwanda. Let's have Professor Monvosin Gebreyesus from the Ohio State University, who has been also working with Africa, training African One Health professionals to share some of their experiences in OHSU or Ohio State University. Sir, please, you can start.
Thank you so much, Renzo. Thank you for organizing this panel, as well as inviting all of us. Great complementary geographic and discipline representation. So great to see that. So I will have few slides to share with you all. Let me quickly do that, and I will go through a few slides just to share what our Global One Health initiative, in short, we call it Go High at Ohio State University, and our global partners focusing few opening highlights of training activities. Thank you, George, Vipat, Phaedra. I think George's overview gives you a great precedence for this in terms of the One Health need. For us as Go High, why do we survive and why are we existing in this world? It is what you see on the right-hand side. I think we all in this panel and participants agree that the world needs capable professionals as well as institutional systems that can support advanced, healthy, but also vibrant, enduring global community. So this is really, One Health is a way to address this gap in capacity. So our focus in our strategy is really to focusing on various aspects of capacity building. Training and education is one of it, which I will try to emphasize today. But on the left-hand side, you see our strategies, mainly three core strategies that are integrated to each other. Integrated training, integrated with research, applied research and implementation science, integrated with outreach and extension capacity. And then we have supportive goals. We have to have effective, efficient resource stewardship and financial sustainability. So with that in mind, just jumping into a training capacity building, we have various platforms. By the way, our Global One Health initiative works in various parts of the world, North America, Mexico, as well as South America, Brazil are two focus areas. Southeast Asia for long term, more in previous years, we used to work with Chiang Mai University, perhaps with Asian Pacific Veterinary Publicans, other groups. Eastern and Southern Africa, Sub-Saharan Africa has become more and more our big emphasis. A couple of formats for our training capacity building I would like to mention is, one is annually we do Global One Health Summer Institute. It started in 2012. Between 2012 and 2019, we trained more than 1,700 trainees. As Fedra articulated, the technical skills, absolutely yes, and Vipat also said it, but also the cross-cutting adjunct skills and various ways of how do you build capable leaders effectively communicating with policymakers in terms of writing grant proposals or ethics, many other issues. On the right-hand side, you see another program that we have in partnership with the NIH Fogarty International Center. Since 2010, we have been running a long-term capacity building platform using a mentored research, sandwich, PhD, and postdoctoral programs. I think we trained about 11 graduated already and about 22 or so in the pipeline that we have in the PhD, postdoctoral levels, and so on and so forth from Ethiopia, Kenya, and Tanzania. So that's targeted institutional capacity building. What you see also on the bottom is considering the global demand. A few years ago, we rolled out online platform, also funded through the NIH, electronic capacity building. So we have a Global One Health electronic portal that free courses, about 16 courses are rolled out, I believe, that anyone can access at that site indicated at the bottom. Then, of course, training capacity building is really, the core part of what we do. And from the get-go, when we started our Global One Health initiative 10, 11 years ago, we anchored it in 4 principles. It has to be mutually beneficial. This is not, we're not a humanitarian organization or helping Africa, helping, it's not that. It really is mutually beneficial partnership. Our students from Ohio State University learn a lot going to Sub-Saharan Africa, going to Latin America, Asia, and so on and so forth. So this is really, One Health is a very mutually beneficial effort as a whole because it's a global need. It's not only just a developing countries need. Second, we focus on current and future complex issues. This is really the term we used, future complex issues. Now, the future is becoming a present, right? We are in the midst of COVID-19 outbreak. But 10, 11 years ago, we brought 13 colleges together. It's not only the obvious health science disciplines, but within our One Health, we have food, agriculture, environment sciences, which is obviously a great fit, but also business. We had lots of great global applied project business professionals working on supply chain of vaccines, logistics, things like that, engineers, social work, and so on and so forth. So we have about 13 of our colleges involved in this focus problem, but also integrated way. While we do the trainings, we use model systems to solve grassroots problems. One model we use, for example, for a long time has been rabies. The model we use to establish a system using rabies is now what we are using in Ethiopia for COVID-19. The same organizations, be it food security issues with agriculture, or of course the Ministry of Health, of course the universities, many issues come into the picture, the regulatory research organization. So we can discuss later on. And sustainability, George said it is core challenge. It's a buzzword, But the way we see sustainability is what we do in building capacity has to be owned by the country after a while. We should not be just Ohio State going forever and training Ethiopia or so on and so forth. So we have great, strong in-country partners taking ownership. Just quick example, COVID-19 is, without mentioning COVID-19, of course, these days you can't really have any presentation. So we have many projects under our Global One Health. The 5 are listed here. We have done completed non-pharmaceutical intervention work in Ethiopia, research prioritization with the Ministry of Science, Higher Education, active surveillance. All of this, not just research or implementation, they have a training component. For example, in the last slide, you see this Mr. Iyasu, when he was trained by Pamela Fry, who is currently faculty member in Missouri. He is, he has graduated his PhD. He did his postdoc with us. He is now with the Ethiopian National Reference Laboratory, the Ethiopian Public Health Institute, doing COVID work on risk communication. So that's really the beauty of One Health. One can start in food safety or rabies, or could end up on COVID or other problems. The same complex problems exist. Just to give you an example of resource stewardship, Global One Health Initiative highly values its existing human resources, multidisciplinary experts across the world, from our Ohio State University as well as our Eastern Africa office. Here you see a group of multidisciplinary people because we established an East African office based in Ethiopia but working in multiple countries. We also highly value the partnership with various stakeholders and funding agencies, many of them listed on the right-hand side. So this resource stewardship is critical to make success, even though I feel One Health is much underfunded. World Bank estimated 3 years ago or 2 years ago, $4.3 billion is needed every year, and everybody was shocked for that news. But look at what COVID-1 pandemic did. Trillions of dollars the world lost. 4.3 billion is a peanut. I mean, we can discuss, but definitely the world needs to invest a lot more on One Health. And hopefully COVID-19 is a lesson to all of us and the global community to invest. I will finish with this slide. Again, it is really mutually beneficial, integrated training, implementation, outreach capacity is our focus, be it on service learning, clinical type of work you see here, or Middle Eastern respiratory syndrome in pastoral area, or workshops we gather, at the end of the day, our capacity building entails much more than training, applied research, implementation, outreach. So thank you so much. Muchas gracias, Murakoze, for Rwanda. Thank you.
Thank you so much, Wonwosen. And indeed, the world now is our audience. And if we can just greet them in all their languages, we have 119 participants in the room. And so again, hello to everyone. I would like to encourage you to keep on, raising your questions in the Q&A button. I'm already seeing a lot of really interesting and important questions. I invite the panelists to answer those that are really targeted to you, but those that are more general and perhaps something that we can discuss or even debate about, we will definitely do that verbally. So great presentations from all 4 of you, from George laying out the the context and the broad vision for One Health, Pat showing how university networks can actually work together to train the next generation of One Health professionals within a region. From Phaedra, we learned about the birthing pains of a young but dynamic Center for One Health and how they're integrating One Health into the curriculum of medical doctors and other health professionals. And from Wonwosen, reminding us about the importance of sustainability and ownership in these kinds of international partnerships. You also made a clarion call for investing in One Health. Hopefully COVID-19 will be the impetus for more resources to be allocated to One Health education and research initiatives. So let me start by asking, and by the way, we have until 3:30 p.m. Oslo time. That's the maximum that we've got. but we'll try to also end as earlier than that, depending on the amount of questions that we get. But maybe for those who are leading One Health programs, and for sure we have participants here who may be struggling with trying to establish their own One Health programs. Can you give us some tips on how you were able to navigate your complex university environment, trying to convince leaders to launch a One Health program? Again, given the interdisciplinary, transdisciplinary nature of these field or approach. Anyone who would like to start?
I'm happy to start.
Please.
So, okay, great. This is a really wonderful question. Looking at how the world organizations in any part of the world are structured, they are highly siloed, vertically, universities are colleges, departments, and so on and so forth. For One Health to be effective, of course, we are at the opposite dimension in a way that cross-cutting. It is not an easy challenge. I think this is an excellent question. It is not an easy challenge, of course. For us, number one, at Ohio State, when we started this, it was bottom-up, grassroots, people who are committed, few champions. Many people were some vocally against the One Health concept or misunderstanding it. Or I'm a veterinarian, my background is in veterinary medicine, and a physician person was joking with me that, oh, are you going to take over? So there is lots of misunderstanding. It takes time, it takes patience, it takes persistence. Secondly, that bottom up, until you get a buy-in from top down, it's often difficult. So you have to convince your top leadership. Of course, that could vary from country to country, organization to organization, but the biggest thing we did as part of our grassroots program was launching a meta leadership workshops, showing that how this vertical side, we're not disrupting departments or colleges, but how this interconnectedness, the horizontal cross-cutting is essential, and showing successes, examples and success. Finally, one point which is very helpful is the silver lining of the diseases themselves, be it hypopathogenic avian influenza, or be it even FMD, which is not per se zoonotic, but big livelihood impact, or COVID-19. This is an opportunity for you to make the case in your organization. Look at COVID, a zoonotic disease that came from wildlife is causing such a havoc in the world. So I think, among the few things, the silver lining of COVID itself is convincing administration. Thank you.
Thanks, Wonwosen. So use the COVID moment to establish your One Health programs. I think that is a very important reminder. How about the others? Do you want to add anything about any additional advice or tips on how to, again, navigate complex educational systems? How to be an advocate for One Health in your universities? Pat, I saw you unmute.
All right, so you can go next. So basically, in the region, if people don't know much about One Health, the first thing that you have to raise the awareness of the people, bringing the stakeholder in the same room with the multiple stakeholders. So if we talk about education side, right? So One Health, people always talk about human health, animal health, environmental, or wildlife, but they don't think of others. There's also other disciplines like social science, faculty education, which is quite critical. You want to empower, teach better, and how to graduate. So first, bringing people together, engage the key stakeholders to raise their awareness. So with that, I also see that some of the meeting, people may not exactly like one another, right? But I think putting everyone in the same room, I think that's a good start. Even though there may have some argument, differences in their perspective, but it's a very good start in bringing them together. If we identify some of the champions on the leaders of One Health, try to lobby them into the group, they can convince other people coming in, and then other followers will come. So that would be a tip. Raising awareness, engage all the stakeholders, identify the champions to gather other people so they are leading figures and other people will follow.
Thank you, Pat. In relation to this question about, starting a One Health program, we have one question from Rohini where, and she's saying that one of the most challenging issues is that One Health is not even an accreditation requirement for MD programs, for vet med programs, perhaps in most countries. Maybe Phaedra or, those who are from veterinary or medical schools have insights on how you're able to actually include One Health, even if, for instance, the regulatory body of that country does not yet require One Health as part of the standard curriculum, again, in that particular country. Any insights regarding that question?
Can I say something about that, Renzo? Yeah, I think what's been said is so true. It's an uphill battle simply because the institutions and the financial conditions across the world have valued treatment way above prevention. And this goes right back to 1915 when Johns Hopkins University, it was actually there at that moment in 1915 when the split occurred between clinical health, clinical medicine, and public health. And so to the point that today, as we are looking at the globe, at the world, across the globe, including most countries across all regions, maybe 4 or 5% of the financial allocations for health are provided to public health, and 95% towards treatments, hospitals, and staff, which are also very necessary. But the imbalance is real. The imbalance is real. And as a result, in the last 100 years or so, a lot of the people involved with the treatment, and important, crucial people, treatment of patients and so on, have gained, of course, a lot of prominence, and their innovations have been outstanding. What COVID is reminding us, what COVID-19 is reminding us are two things, really, is that it's not only military security that's really at stake here, but it's health security. We have not faced this before, not in our lifetime at least. And secondly, it's shone a big light on global imbalances. We've got 7.8 billion people, out of whom maybe 5 billion are not arguably reaping the benefits of their societies. And I think so we're looking at a big hill that we're climbing. And you're quite right, you start grassroots upwards and so on. But I think we need to keep in mind what we're up against. It's not what we're up against, it's what we need to do to get together to understand each other better than we're doing now. It's not about fragmentation, it's about getting together. Yeah, thank you.
Right. So now is the time to put our money where our mouth is, right? And if we really say that this is the time for, this is the era for prevention, especially COVID-19 is really highlighting the importance of prevention, then we need to make sure the money is, more money is allocated for prevention, and then hopefully education and research will follow suit. I saw Phaedra unmute. Maybe you have some insights regarding the earlier question about the challenges of starting a One Health program, accreditation, the requirements of regulatory bodies, etc.
Sure, yeah, thank you. So, I'm lucky to be at an institution, as I mentioned, that valued One Health from the beginning, and being in a country that also values One Health policy that's integrated into the government. So we were lucky enough to have a module that stands on its own of Introduction to One Health for a medical degree program, but I'm also aware that, around the world, this is not very common. And even that medical degree programs are not even talking about climate change and health, which is one of the biggest, health emergencies of our time. I would say advice to go around this is, I talked about integration of One Health into other modules. So you can very simply, and with, not a lot of time taken from what is an intensive degree program, to talk about an example of One Health. So if there's someone in an institution that can, review different curriculum where, showcasing an example, a slide introducing One Health, I think can go a long way. I think other kind of resources, at least just talking about medical degree program, is advertising, there's different alliances of doctors that I believe there's one with Planetary Health Alliance, with clinicians, different organizations where doctors and other health professionals see their place in this field of One Health and starting to have to care about the environment. And I think, doctors and other health professionals are in the right place to be an advocate for One Health. So it's about, both trying to integrate into what is a heavy curriculum, advocate to leadership in order to make that more intensive, and also provide resources on, who's already doing this and make it relevant to the professional.
Thank you, Phaedra. And you mentioned about, incorporating One Health into, the curriculum. We hope more medical schools and veterinary schools and other health professional schools around the world will copy your innovation. And that somehow answers one of the questions from one of our commissioners at the Lancet One Health Commission, Maria Lipinski. She was asking, what are the big innovations you have seen, meaning you, the panelists, recently in One Health training? Maybe you can add a few more, and maybe they're just in your own backyard, these innovations that you might want to share to Maria and to the rest of the audience.
Well,
George?
you're just going to say while you were speaking, how difficult it is to integrate, and I know Phaedra is doing some excellent work. I think one thing, one hope our project is trying to do is we're trying to really introduce basically the One Health concept, or different names maybe, even into the primary education, secondary school education, tertiary education, because it really has to start, the whole concept about respect for each other, respect for nature, respect for the future starts at a very young age. And it starts in the home, it starts in the family, it starts in the community. And that's where I think a lot of our work needs to be, in communities with families and the teachers and teacher training colleges and so on. We've got to get in there because the teachers have a huge following, in terms of parents, the students and so on. So I think getting the integration of the One Health concept and well-being concept in the early years, I think is absolutely essential. So when students graduate from secondary schools, they come out with a different orientation about the world. Currently, to be sure, there are over 800 million, as we speak, 800 million younger people unable to access education as we speak today. Over 800 million, going up to 1 billion. So I think all these young people sitting at home, many of them sitting at home right now, many in blended learning environment, but are asking themselves, why? Why is this happening to us? Why don't we understand? And I think the parents, we don't understand either totally the impact. But it's got to start with, introducing students very gradually, not intimidating them, in a friendly way, saying, these things happen in life. We've got to find the resilience to beat them, something like that. Thank you.
Thank you, George. And your point regarding bringing One Health not even to the university students, but also to pre-university students. That is actually echoed by John Philippe, who said, OH initiatives are mainly led by universities. However, OH cross-cutting skills can be actually or more efficiently acquired earlier in life.
Absolutely.
And actually, we are planning a future webinar as part of the series under the Lancet One Health Commission, a specific episode regarding One Health in K-12 education. So please, keep abreast of updates from the Commission for that future session. And, we're looking for great panelists for that particular session. So if you have any suggestions, please reach out to us. Let's still continue the discussion about innovations. And, I know, Pat, and, you kind of touched on this, but maybe you can elaborate about the fellowship program, for instance, that you have. And you also highlighted a while ago about the importance of, you call them soft skills. I always say leadership skills are not soft at all. But it's important because One Health is not just, we're not just trying to produce technicians here, who can, fix the broken faucet. We want, leaders who can navigate and survive and thrive in very cross-sectoral, environments. So maybe Pat, you can share a bit of, again, I think because this falls under the innovation question, your fellowship.
All right,
and
so,
other.
Thanks for that. Before that, Fedra, I touched upon, it's very critical try to embed integrated One Health into the curriculum, right? So it's not easy to change because we also hearing in our experience that the medical school already have lots of credits already overloaded. They cannot add anything else. Veterinary the same, professional. So we can start, little by little, like, having a lunch seminar, introducing the topic, having inserted a couple sessions, 1 hour here and there. When they start seeing the more importance, they can be more incorporated. Or in the introduction to public health, they can include the topic of zoonosis, right? Include the example of COVID-19 and insert the definition of One Health there. So that can be added to how we can get things started and get the ball rolling. So Renzo touched about the fellowship program. So I alluded a little bit about the Sihun Fellowship Program. We see as a practicum for the young to mid-career One Health professional getting a real practice in the real world. So we place this young to mid-career professional at the leading organization of One Health. So we have the placement as a FAO, regional office in Bangkok, for instance, OE, regional office in Bangkok. We place International Livestock Research Institute in Hanoi, so on and so forth. So they get the hands-on practice and real-world experience from the leading experts. So that's what our program can do, right? So lastly, before I open the floor to others, you touched on the soft skill. Some people don't like the word soft skill, so it's debating, right? They say essential skill or important skill, but I think that is most commonly people still refer to soft skill. So coming down in a nutshell, I think a lot of people alluded to the 4 C's. So communication, collaboration, critical thinking, and creativities. I think if we can build the kids, younger kids, as well as the adults want to have these 4 skills, I think we're gonna go a lot long way. Because just take one instance for the communication. So you're a great thinker, great leaders, having a cutting edge research, but you cannot really communicate that to others. Like, you publish the thesis of 100 pages. No one really gonna read that. How are you gonna communicate that? Right now it's through infographic, right? So that's the kind of the other skill that this student that we should hone and thinking about to really transform what you know to the lay people and really make impact. So I leave it there.
Thank you very much, Pat. And of course, in the age of social media, we might need to even train our One Health professionals on how to tweet their messages, as a gateway, to their amazing publications, but also even writing of op-eds, verbal communication skills, all of these, skills vital for effective communication again in the 21st century. Wan Wosen, do you have anything to add regarding this question about innovations, soft skills, quote unquote?
Just a quick comment. Definitely, I comment the what we call it adjunct skills, and this soft skill is the same thing issue. NIH especially likes adjunct skills, but Pat, what you said is very well taken. And we're, as Renzo said, we're producing leaders, critical mass of scientists with a complementary ability. So besides the intellectual capability, how can we improve their emotional intelligence and all related issues? So that gets to leadership. So I don't want to repeat that, but I just want to comment. That point is very well taken. But I want to go back one point I have on the curriculum issue, which is a very critical center for this panel, is what we do at Ohio State is not, number one, it's not easy to change a core curriculum of medicine or veterinary or nursing. We realize that, and we don't wish to change it because our goal is One Health, right? So we created interdisciplinary program, interdisciplinary global One Health certificate. So any of either professional or master's or PhD even students from the various involved colleges can come and take the There is a core set curriculum and elective courses to earn on top of what their degree is. It might be MD or DVM. They can earn the additional certificate. So it's an interdisciplinary program. It's easier to establish, and it also fulfills our purpose as One Health.
Thank you so much, Juan Wosen. We have a question now regarding, the supply of One Health education. According to Supasiri, there's, the interest in the One Health profession is keeps on increasing. In your opinion, will this interest exceed the demand, or I guess what she's trying to say is, will the education sector be able to catch up with this growing demand for One Health training and capacity building needs? But also, I think the other question in relation to that is, do we have enough jobs for those who will actually get advanced training and additional qualification in One Health? So can the education sector catch up? And then can the job market catch up as well? Anyone who would like to start?
I think that just to say, we definitely are going to be moving, regardless of where we live, into green economies. There's no doubt about that in my mind. We have to. And I think the opportunities for industry, business, engaging people who are able to act as change agents, if you will, transformation changes, is going to be very, very high. There's no doubt in my mind as well about that. And these people will have to have certain special skills, they're different competencies. How do I work with company X and so on and so forth, and advising. I do see one thing in response to what you're saying is, I do see really a good possibility that a lot of public health schools of public health or equivalent are already developing competencies with regard to what you're saying there, that the need, so that the graduates, for example, the European, the ASFA, the Association for Schools of Public Health in the European region, has just come out 2 weeks ago with a brand new sort of competency documentation, along with the World Health Organization, so WHO and ASFA, which I think is excellent, absolutely excellent. The work's gone in is 3-4 years of hard labor has gone in, and the leaders there have done a phenomenal job, including a section, a major section on One Health. So it's an integral part of the whole. So I think we just don't know, but I think the demand is definitely going to be growing in the next 2-3 years. And I do think that many of the public health institutions are meeting the challenge, are going to meet the challenge. And I think the employability, and this is just a guess on my part, is going to be there for many, many people. Absolutely. Just judging by colleagues. Thank you.
Thanks, George. Any additional insights regarding the job market and also the demand for more training and program in One Health? Pat.
Right. So my thought for One Health, when we talk about One Health, should be the question that we often ask that, get asked that, should we have a master in One Health? But basically, you would say that the One Health is an approach and discipline which is quite broad, boiling down to how we can actually work together. So no one will know all, right? You can be a physician, you can be veterinarian, you can be modeler, you can be health economist. Costing, how much does it cost? You be statistic, right? Doing a model of the COVID-19 outbreak. Social science, how we can induce behavior so people can wear masks more. For instance, so there's a variety of discipline. So the One Health is just a touch point that, how we can bring the people in coming to work together with their own expertise, right? So if we have that, I try to foster whatever that the adjunctive skill or soft skill, essential skill, whatever, that in demand, I think that, we're going to have a good part and can produce a good graduates that can work together to solve the complex health problem, anything on that part. So in terms of sufficient job, right? So I mean that the supplies are there. If we can trace and try to change the curriculum and see different people coming to work in One Health. For the job, we know that the job that what you learn today, may not be applicable in 10, 20 years in the future. With technology change, with the flow changing so quickly, but we believe that we induce the continuous learning, right? Lifelong learning that we should. So we can embed that since the kids since the universities. I think whatever that transformation might be, right? It's going to be transformation. It's so predict what's going to happen 20 years from now. But if you have become a lifelong learner, you're going to survive regardless what kind of job market is. So I think that's what we should promote.
Thanks, Pat, for those important reminders. And indeed, no one or no single discipline has the monopoly for One Health or of One Health. In fact, our panel here is somehow reflective of that. I think we all come from very different disciplinary backgrounds. We have Juan Vossen, who's a veterinarian. I'm a physician. George is a leader in education. Pat, again, what's your background, Pat? And then Phaedra, I know you both have PhDs.
We have engineering background, by the way. So
engineer, and Phaedra is
environmental.
environmental science. So, sorry, George, want to say?
Just a fast comment. A study that was done, I think, by Duke University, Harvard University, about 5-6 years ago, I think, reflected the problem. You see, they concluded that one of the conclusions of the study was that only about 3% of all medical schools in the United States taught veterinary medicine. And when you went to the veterinary medicine side, 3% taught about human medicine. And I think that is maybe a big start, something to think about. But I think that something else that comes to mind very quickly, again, is that it's not only what we teach, it's how we teach. If we continue to teach didactically, preach and teach and preach. I stand in front of the students in a lecture theater, who's going to become almost an obsolete approach, really, seeing the world today. But if we teach like that, yes, I become the center. I'm the sage on the stage. I become the person who delivers the information. And of course, I have a captive audience in front of me if they come to do lectures and so on. What I think we need to really think about, talk about innovation. This is not a new innovation. It goes back to the 1960s in Canada at McMaster University, actually, and that's problem-based learning, inquiry-based learning, whereby multiple professions learn together about certain issues. And I think that is when you bring your veterinary medical doctor, you bring in your psychologist, you bring in all these different people to deal with issues as we're learning. The way that hospital workers and are working together today about cases and so on. But why should students wait until they get to the hospital environment in order to deal with that? So that's really inquiry-based learning. So it's a different orientation to how we approach the learning possibilities. I think that would be useful. Thank you.
Thank you so much, George. One Health could be the anchor for greater interprofessional learning, education, again, across different health professions, something that we've been aspiring for so long, but still, I think quite a challenge in many different settings. I just want to pivot to another topic, which is, as you now said, political commitment is important for integrated work for all One Health activities. I'm just curious, based on your different examples, how are your programs interacting with government? And oftentimes these important pioneering ideas emanate from academia, and unfortunately sometimes the realm of policy, governments are slow to adopt these new ideas. So can you share some stories of how your program, education and research program, actually led to the eventual adoption of One Health as part of your country's or a country's health policy or food policy or policy towards pandemic prevention? Anyone who would like to start? I saw one wasn't unmute his mic.
Yeah, I can start, yes. So I can give you an example from our work with Ethiopia. When we started back in 2009, 2010, I think the first thing we did was we didn't go in there and say, okay, I have this expertise or Dr. X has this expertise and we want to do this work in Ethiopia. Rather, we engaged the State Minister of Health and asked her, what problems do you have? What are your priorities? We would like to partner. We didn't need assessment as experts, but also as a top level, it's the ministerial level. They gave us, these are the priorities. If you really want to partner with us, they gave us 2 or 3 major problems. One of them, we didn't have expertise. We were not much interested, but we picked at that time rabies. Rabies is one of the oldest classical disease, 100% case fatality, 100% preventable. There is effective vaccination. It's a low-hanging fruit. We have expertise. The country has a big disease burden, so we prioritized it as the primary one. We used it as a model system. So we brought together the ministries, the various ministries, starting from health, but also education, agriculture, and wildlife, others. At the end of the day, we became about 16 organizations, Ethiopian organizations. The US CDC became a partner, one industry partner from vaccine, Merck at the beginning of our work, and so on. So we established really a system. While we make grassroots impact using rabies, we were training people. Awareness, as Vipat said, has been critical, bringing these organizations together and meta leadership, what I said earlier. How do they communicate each other? How can you effectively work across administrative boundaries? You all know it. It's a big challenge, right? Across discipline barriers, across administrative barriers. Fast forward, I think many of you know global health security agenda came 3-4 years later. So through a global security cooperative agreement with the Ethiopian government and the US CDC, we started really rolling out a program. So that program has really led into 4 major simultaneous efforts, regulatory related efforts, mass vaccination, establishing surveillance and monitoring system. In fact, it helped us establish our regional office in Ethiopia, which whose director, the regional director, is a physician. I'm a veterinarian sitting in Columbus, Ohio. Our wonderful regional director, Dr. Getenet Yimar, is a physician. We have others, veterinarians or business administration, MPH holders in our office and working with the Ethiopian government, which resulted in major impact. Measuring impact is not easy. We hoped we saved many children's lives through this effort, but it's not easy. It's a long way to go, but I want to share that as an example.
Thank you, Ndwasen. Again, the importance of listening to governments, to our partners. Phaedra, do you want to add?
Sure, yeah, thank you. Again, I think I mentioned I'm in a unique situation in Rwanda. The government of Rwanda has really embraced One Health. In policy, it has a One Health policy, as well as a One Health strategic plan, where 2 of the priorities from that was, education. So both UGHE and the University of Rwanda, the largest national university, were invited as a part of the strategic planning process, which was really exciting to be able to help guide what the strategic plan looks for the government. And also similar to what Wanwasan said about areas of priority, mainly diseases of priority, and how we can align our research agenda at UGHE with what the government's priority areas are. Another kind of unique connection that we make with the government of Rwanda is utilizing members of the government, different ministries, to come teach in our programs. So we've had, ministers, we've had the Director General of the RBC are all adjunct faculty at UGHE, and this helps, both our students learn about policy and integration of One Health at the government level, and it also keeps our connection there. So that's kind of, a way to do it as well, is utilize members of the government as part of your teaching faculty.
Thanks, Phaedra. I think that's another innovation, bringing, the leaders and the policymakers and decision makers to the room in order for them to interact with the students. Pat, I'm curious, your program has been existing for nearly a decade. How are you measuring, policy impact of, Seohon. When Wasson mentioned about the impact might be a bit challenging to measure, but maybe, in Seohon you have ways to actually, determine how you're making a real impact in the world of policy and practice in Southeast Asia.
So I think that's a tough question. I wish I have a good answer to that. The policy impact, I think, is very difficult to make. But in our group, we try to engage the stakeholders both at the ministries, Ministry of Health, Ministry of Agriculture, Ministry of Environment, when we work, doing the work plan, doing the engagement. We also invite them to join, especially all those programs of the field epidemiologists. So that's how we getting involved into the role of what government thinks and what their needs, what are the gaps that we can work together to help address. We also, as the regional, right? So we have been sitting on the platform, like for the global health security agenda, there are different action packages. So the action package Detect 5, which is on the workforce development, the Southeast Asia One Health University Network is one of the contributing organization on that. So in the society meeting, our role is being there, listening in and see how the university can address and can work together to foster and the champion of the development of the field epidemiologists, for instance. We also at the regional, we engage with the ASEAN +3, FETN. ASEAN +3 means that ASEAN member state plus China, Japan, and Korea. For that, and then plus field epidemiology training network. So that's focusing on the field epidemiologist group that try to train the health professional serving the Ministry of Health. We also engage with the ASEAN Health Cluster 2, which is responding to all hazards and threats. So when they have a policy dialogue, we are there, not on the table trying to make a contribution, the ideas and being the arm, whatever that capacity building need or the research need that the regional or the countries want. We believe that our university can be a helping arm to address those needs and gaps.
Thank you, Pat. So we have very limited time for a few remaining questions. A lot of the questions are asking, how can we get into your programs? What are the other programs that are available for us wanting to pursue a PhD in One Health? Is there a room for, for an epidemiologist or a veterinarian like me? There's room for all, that is the beauty of One Health. And I actually would encourage our participants to visit the websites, of course, of the Lancet One Health Commission, but also of the different institutions represented today. You can also reach out to George, who is convening the One Hope, as we already described a while ago, One Health and One Planet Education Initiative, which is a global network of many schools, colleges and universities offering One Health programs. I'll go to these last set of questions, which I think are very critical. There's one question about, and this is from my friend Godely Van Heteren. I hope you're still there listening. Some of the programs that we're talking about have been, incubated in, let's say, the global north, Ohio State providing these short courses, in Ethiopia, the University of Global Health Equity in Rwanda has very strong ties with Partners in Health, based in Boston, affiliated with Harvard, and Seohon was born out of a collaboration between several universities, including University of California, Davis. So the question here is, the question is, could you share with us a bit about, the trouble or the challenge with some of the continuing North-South inequities and global health educational architecture? How can we make sure that we go beyond, paying lip service to equity and making sure, I guess this somehow resonates with what Wasson was talking about a while ago, this sense of ownership. And maybe we can just explore a bit more this area, which is related to this growing discussion around decolonizing global health. And maybe we should also be discussing about decolonizing One Health. Okay, so any thoughts about these kinds of north-south relationships, and how can we make them more reciprocal and egalitarian?
I'll just make one fast comment here. Again, I don't have the answers to the question per se, but I think we have to be very careful between rhetoric and reality. And I think there's a lot of rhetoric. For example, when climate change, the accord was signed in Paris in December 2015, I think 196 countries signed up to the climate change agenda. The United States pulled out in 2017, and other countries seem to have slowed down their support. So 2 weeks ago, at the United Nations, 2 weeks ago, 64 countries supported climate change. So you start thinking, well, the United Nations, the Sustainable Development Goals, and I'm not knocking any of this, I'm just saying reality is that in my research, it has shown that many industries, many countries have indicated very low interest in the SDGs, which are really the only strategy that I can think of for the world, really, at this point in time. And you would think that countries like the United States, like Canada, like UK, would put that as a #1 priority, but they don't. So, but they haven't, but they may do now without COVID-19. I'm hoping that this. So I think all I'm trying to say is the North-South divide, equity. There's a lot of good intentions. The African Union, the development banks, and Southeast Asia and so on are excellent. I think we need to get more collaboration, though, global and regional collaboration, to work things through, and being very honest about, more transparent about what the reality is.
Right. How about the others? Any thoughts on how to turn good intentions into reality? Juan Vosen?
Yeah, let me quickly comment. I'm sure all my colleagues have comments on this. Excellent question. Absolutely in agreement. I think, first of all, capacity building when a North and South Institute partner, first, we all recognize and we admit for sure there is inequality, right? So there is lots of skilled manpower in North side, lots of need on the South side. But that doesn't mean that the partnership is a one-way process. We also have to recognize that the North can learn, our students from Ohio State can learn a lot, be it in Rwanda. We're sending a student in Rwanda in a couple of months when COVID, I and Fedra were discussing earlier today. Our North learns a lot. Even our faculty members, senior professors, learn a lot from Africa, Latin America, or Asia. So it's a two-way process. That's why we say mutually beneficial. Once we recognize that, for us 10 years ago, I think what made our program successful is we fully internalized and endorsed that. It's a two-way learning process. Having said that, I really, this is one of our key colleagues long time ago, one of the advisors said, don't be somebody's field site. As an African or Asian organization, I agree with that wholeheartedly. I say it again. Don't be somebody's field site. Professor X comes from US or Sweden and be a field site for his data collection. That's not capacity. That is excellent question. That's a lip service. Let's do a true mutually beneficial way. Great example, UGHE. From the inception, I knew the One Health was in mind. I knew it years ago. I talked to the founding members when they established. Physically being present together with Rwandan governments, that is really witnessing way beyond lip service, a true commitment. For Ohio State, our board of trustees excitedly endorsed it. It took us years to convince, but once we convinced it, they noticed our mutually beneficial, our board of trustees endorsed it. We opened office present, even if the office is in Ethiopia, working in, now I think we work in 6 or 7 countries here in Africa. My last point is capacity building is also, it's not only about workforce development. The problem for a long time, Europeans, US, Canada, scholars come, They do PhD, fly back to Kenya or Ethiopia or any country, and then there is no resources, the laboratory tools, the adjunct skills to be able to develop competitive proposals, be able to commit. All those were lacking. Our recent model of capacity building is not that. That's not for me capacity building. So it needs to have that workforce, infrastructure, system integrated way. So let me stop there.
Thank you, Wanwasan. I just want to include this last question also from Godelive. She's trying to really push us, and challenge us. Are we really trying to radically transform, health, the health sector, the education sector, by introducing these new, One Health programs that are still part of more traditional business models in the field of education? And so, I think, this relates to this idea of how can we move beyond paying lip service to, this very ambitious visions of the future. I think this is a good way to end this conversation. Any remaining thoughts from the panelists? Or is it a hard one to just, please, Pat.
No, sorry, Peter. No, we're being brief because we're short for time. So I agree with Wanwasan said that just adding. So capacity building is nothing, right? If you cannot run on its own after that. So first, in our network, initially it's going to be north to south. So training a lot, from the university in the US, University of Minnesota, TAF, and right now we are dealing with having a consortium with the University of California. So after that, we initially starting with the 4 countries. So after the capacity building is built, within that, we expand on the south to south. South to south means that, when we have new countries, rather than, having a faculty come from the US, we just utilize the existing expertise that already been trained within our countries. So being exchanges on that part. They also try to attract, right? So we start with only 10 universities. Right now we have 84. So those existing 10 are quite strong. So they go out and help others and then bring those things into the mix. So I turn the mic to Fedra, who's unmute microphone about at the same time.
Yeah.
Sure, no problem. And I know we just have a couple minutes left, so I'll be quick. But just to mention that UGHE, we are based in Rwanda. All of our staff, leadership, and faculty are in Rwanda. So I think it's important to have global health work based in the global south. So not have offices are led from other areas, and that the funding can sit physically in the different countries. So I think that is a really important way to help decolonize global health and to strengthen south to south collaborations. I know a lot of funding calls are coming out right now that for partnerships between different institutions south to south, where the money can sit in these institutions and not coming from other institutions in the north or western countries.
Thank you very much, Phaedra, for those remarks. Wow, this has been a very rich, dynamic conversation. Thanks to our very active participants who ask a lot of questions, very important and challenging ones as well. And of course, thank you to our esteemed panel, George, Phaedra, Wanwasan, and Pat, for this global conversation about One Health education. We have a lot of important insights and principles, a lot of innovations that you've just shared, but also a lot of visions and plans for the future of One Health education. Obviously, it doesn't end with a 1.5 hour webinar. We still have a long way to go with One Hope, as it tries to really bring One Health and the hope that One Health brings to educational institutions across the world, from primary school up to university level. So that's the only time we've got, unfortunately, but I would encourage the participants to please visit the webpage of the Lancet One Health Commission at the University of Oslo's website for future updates. You will also receive a copy of this, this webinar, this recorded webinar, as well as future updates as to the future, episodes of this series. So again, thank you for joining us. Please remain healthy and safe, and see you next time. Goodbye.